Social connectedness, religiosity, spirituality, and sexuality. Why does quality of life matter as we age? Social connectedness is the measure of how people come together and interact. At the individual level, social connectedness involves the quality and number of connections one has with other people in a social circle of family, friends, and acquaintances. Whereas religiosity is a comprehensive sociological term used to refer to the numerous aspects of religious activity, dedication, and belief. And spirituality conveys the notion of a personal search relating to things sacred and transcendent. And sexuality is the quality or state of being sexual, the condition of having sex or sexual activity, or an expression of sexual receptivity or interest, especially when excessive. So what is social connectedness in relation to well-being? Social connections provide people with the emotional support, material help, and information they need to thrive. Social connectedness, both the sum of individual relationships and a sense of belonging, is crucial to overall health and well-being. What are the health and other implications of social connectedness? We will answer this question. It provides people with the emotional support, material help, and information they need to thrive. Social connections, both the sum of individual relationships and a sense of belonging, is crucial to overall health and well-being. Greater social support has been linked to a lower risk for cancer recurrence, higher survival rates among heart attack survivors, lower blood pressure, a better immune response, and better psychological well-being. On the other hand, social isolation has been associated with an increased risk of multiple diseases and mortality. Although receiving social support is important, providing social support to others is also linked to better outcomes such as a higher self-esteem and a greater sense of control. Children exposed to repeated violence who have social support in their family, school, and peer groups function better than children without these supports. Social connections lessen the impact of stress and trauma. Just knowing that support is available, even if it is not needed or used, gives people a sense that they have someone to turn to, even in a time of need. Increased social cohesion is linked to reports of greater neighborhood safety for people living in low-income public housing. And social cohesion is also related to higher rates of physical activity and lower risk for obesity among children and adults alike, regardless of neighborhood physical characteristics. So, social connections are important for health benefits as we age. Factors such as race, class, gender, age, and education can impact social connectedness. People living in poverty are often in greater need of social support, but often have fewer actual and perceived social supports. They're also less likely to experience the connectedness across differences such as race, culture, and class that give people not living in poverty greater connections to resources. Social connectedness may be one factor that helps to explain unemployment disparities found among white and black adults. For example, 70% of jobs held by white employees were acquired through their social connections to their white peers with more access to resources than racial minorities. Reciprocity is important for health and well-being, but people living in poverty often experience an imbalance between the support they provide and the supports they receive. As people age, their social networks often become smaller and their social ties weaker. Individuals who live in more rural areas are likely to have more social support and fewer negative interactions, even though poverty is more common, the opposite of what you would think. However, all relationships are not equal. Positive relationships involve reciprocity and trust. However, even positive relationships can cause stress and feelings of exploitation. On the other hand, relationships labeled by outsiders as detrimental and problematic can have positive aspects. For example, a person may choose to live with a partner who is an alcoholic because the relationship provides safety, companionship, and shelter. For this reason, it's critical to take into account the full context of a relationship. Furthermore, the diversity of people's relationships matter, especially for children and youth. Youth need to connect not only with peers, but also with supportive adults, family or non-family, for healthy development. Social connectedness is sustainable and only when it's long-term. Relationships that can be relied on over long periods of time and comprehensive, encompassing emotional, material, and informational support from a number of individuals. In essence, all relationships are not equal. So how is social connectedness related to well-being? It must be experienced along with stability, safety, mastery, and meaningful access to relevant resources. Regarding social connectedness and safety, a growing sense of safety and trust in others enables social connections to develop. Existing social connections may actually protect against the negative effect of unsafe conditions. For example, a sense of connectedness to a particular group or community helps to offset the negative physical health outcomes attributed to living in a high-risk situation or community. Social connectedness and meaningful access to relevant resources through formal, like service providers, and informal friends and family connections with others, and individuals become aware of resources available to them. Although connections with others may enable a person's access to resources, who is actually providing the support matters. Access to only formal support may compromise a person's sense of control, choice, and efficacy, because formal support is often one-sided and time-limited. Furthermore, some individuals prefer support from friends and family and are more likely to follow through on recommendations given by these connections. So what is religiosity and spirituality, and why does it matter to healthy aging? The percent that say they consider themselves to be religious or spiritual varies widely, with lows of 12.9% in China, 25.4% in Japan, and 33% in Thailand, with highs of 99.8% in Pakistan and 95.8% in Nigeria and 85% in Turkey. A broad range. The percent in the US is 67.9% consider themselves to be religious or spiritual. Older adults are more likely to report they're religious or spiritual. There's evidence to suggest that people become more involved in religion and their sense of spirituality magnifies with age. Religiosity and spirituality are key components of health within the context of global aging and expanding life expectancy. Evidence links religiosity and spirituality to health of older persons. A connection between religiosity or spirituality and health has been recognized for decades, if not centuries. Scientific dialogue on the topic accelerated in the 80s and 90s with influential studies that focused on mental health. Religion has specifically been found to exert positive impact on disability and depressive outcomes of older adults. And recent years have witnessed proliferation of research on mechanisms that link religiosity with health outcomes. Demographic research has, for one, been critically involved in linking religiosity and longer life. Statistical correlation between religiosity, spirituality, and health has been found with cardiovascular conditions in older persons, such as heart disease, blood pressure, high cholesterol, and myocardial infarction and stroke. There's also strong evidence of a connection between religiosity and mental health. Social support, like religious institutions worldwide, such as churches, temples, and mosques, are often a focal point for interaction, exchange, and support. Regarding behaviors, religious institutions have long been viewed as organizations that support healthy behaviors. In regard to stress, a chief function of religion is to assist in the face of adversity. This is important for older persons who often cope with losses of loved ones, loss of mental and physical function, and the propensity of their own mortality. In regarding psychological responses, by promoting forgiveness, religion has shown to reduce feelings of hostility and anger, which is also beneficial for health. So there are 4 distinct benefits for healthy aging: social support, improve behaviors that are healthy, reduce stress, and psychosocial responses of support. The state of the science and why it matters for healthy aging. Research on religiosity or spirituality in health can be controversial. Critics of religiosity as a determinant of health can be outspoken. It can be considered unscientific to consider religiosity among other health determinants, despite evidence cited in the prior slide. Yet there does appear to be an intensification of spiritual affectation with healthy aging. Thus, it probably matters. And what about sexuality in older adults? Many older adults are sexually active. Women are less likely than men to have a spousal or other intimate relationship and to be sexually active. Sexual problems are frequent among older adults, but these problems are infrequently discussed with physicians. Sexuality in older age concerns the sexual drive, sexual activity, orientation, intimacy, self-esteem, behaviors, and overall sexuality of people in middle age and old age, and the social perceptions concerning sexuality in older age. Older people engage in a variety of sexual acts from time to time for a variety of reasons. Sex is a vital part of human longevity as it can enhance physical, mental, and emotional health. It's important to the regulation of various health indicators such as blood pressure, immunity, improved sleep, heart health, muscle strength, and reduced risk of hypertension, stroke, and heart disease. That's just to name a few benefits without mentioning its ability to relieve stress and boost brain health and self-esteem. So, sex does impact healthy aging. Many people want and need to be close to others as they grow older. For some, this includes the desire to continue an active, satisfying sex life. With aging, that may mean adapting sexual activity to accommodate physical, health, and other changes. There are many different ways to have sex and be intimate, alone or with a partner. The expression of your sexuality can include many types of touch or stimulation. Some adults may choose not to engage in sexual activity, and that's also normal. Normal aging brings physical changes in both men and women. These changes sometimes affect the ability to have and enjoy sex. A woman may notice changes in her vagina as a woman ages. Her vagina can shorten and narrow, and the walls can become thinner and a little stiffer. Most women will have less vaginal lubrication and may take more time for the vagina to naturally lubricate itself. These changes could make certain types of sexual activity, such as vaginal penetration, painful or less desirable. Vaginal dryness is an issue. Using water-based lubricating jelly or lubricated condoms may be more comfortable. If a woman's using a hormone therapy to treat hot flashes or other menopausal symptoms, she may want to have sex more often than she did before hormone therapy. As men get older, impotence becomes more common. Erectile dysfunction is the loss of ability to have and keep an erection. ED may cause a man to take longer to have an erection. His erection may not be as firm or as large as it used to be, and the loss of an erection after orgasm may happen more quickly, or it may take longer before another erection is possible. ED is not a problem if it happens every now and then, but it is if it occurs often. And someone that has this needs to talk to their doctor. Some illnesses can impact the ability to have sex. Joint pain can make sexual contact uncomfortable. Chronic pain can interfere with intimacy. Dementia can either cause increased interest in sex, but they may not be able to judge which is appropriate. With diabetes, men often have erectile dysfunction. In heart disease, narrowing and hardening of the arteries can change blood vessels so that blood does not flow freely. And also, with incontinence and loss of bladder control or leaking of urine is more common as people, especially women, grow older. All of these can cause sexual problems. In addition, stroke can sometimes affect the ability to have sex. Depression can too, because there's lack of interest in activities that used to be enjoyed, such as intimacy and sexual activity. And also, surgery can have an impact, like a hysterectomy, mastectomy, or prostatectomy. Also, some drugs can cause sexual problems as a side effect. And too much alcohol can cause erection problems in men and delay orgasm in women. So there are many problems that can cause sexual dysfunction. So what can older adults do? There are things you can do on their own for active and enjoyable sex life. If they have a long-term partner, they can take the time to enjoy each other and to understand the changes they're both facing. They shouldn't be afraid to talk to the doctor if they're having a problem that affects their sex life, because there may be some treatment that's available. And talking to the partner or partners about the needs. They may find that affection, hugging, kissing, touching, and spending time together can be just what is needed, or a path to greater intimacy and sex. In summary, social connectedness, religiosity, spirituality, and sexuality are all important for healthy aging. Thank you.